Well, I am so thrilled to welcome all of you to the Integrative Health and Wellness Caucus Congressional briefing on integrative health for pain management. I am actually right in the middle of a hearing right now in Ways and Means, and so I have to hurry back. But I did want to tell you that on the Ways and Means Committee, which is considered one of the most powerful committees in Congress, I am on the Health Subcommittee. So I hope I can be your advocate on alternative pain treatments. And I am so excited because you are presenting to Congress the alternatives that can take place, especially in this time when we're suffering from an opioid epidemic. And that's why I agreed immediately to be a co-chair of this caucus. I think if you can hold events like you did today and that you are doing today with all the treatment modalities out there, you can raise awareness about the value of these treatments. And I already know that the staffers around the Hill are very excited to be the recipients of these treatments. So I think that you're making a big hit already with what you're doing. So let me say I'm thrilled to also to be co-chairing this caucus with Congressmember Jackie Walorski from Indiana. Both of us are committed on educating our colleagues and staff about the importance of integrative health in our healthcare system. The opioid epidemic is taking over lives in every state, every day. Right now, deaths from overdoses exceed those of all other deaths for people under 50. Prescription painkillers are extremely addictive and overprescribed. And in an effort to combat this treatment, we and everybody are looking for ways of having alternatives for pain treatment. The good news is that studies conducted by NIH have concluded that alternative treatments can be effective in treating conditions like chronic pain. And that is why I was proud to work on language with Congressmember Walorski last year that was ultimately included in the comprehensive opioid package, and that was in H.R. 6, a bill that did pass last year. Our language instructs the Center for Medicare and Medicaid Services to study the barriers that Medicare patients face in accessing integrative therapies and alternative therapies. It's so important to identify these barriers as we work to expanding integrative therapies for all patients. So let me tell you a little bit about my background. I started actually in the state legislature, and I started off on the issue of acupuncture. And when I started off, I got elected in 2001. There were very, very few people that knew what acupuncture was about. They had misconceptions and stereotypes. And so we embarked on an effort similar to this, where we had briefings, where we had demonstrations, and people could learn more about acupuncture. And ultimately, we were able to pass numerous bills that, for instance, got acupuncture into the workers' compensation system and many other positive steps forward. So I totally understand how important these alternative therapies are. But here in Congress, our biggest challenge is convincing our fellow members that not only do these integrative therapies work, but that they should be available to all patients, no matter how they get their health coverage. That's why this caucus is so important today. These actual demonstrations are so important. So I wish you luck in today's presentation. And if there are any staffers here, I encourage your members to join the Integrative Health and Wellness Caucus. We really want to grow our numbers so that it can be as large and representative of members of Congress as possible. So thank you all so much for being here today.
Good afternoon. Are you guys asleep already? It's 10 till 12. Wake up. We have things to do, right? Representative Chu and I are on the Ways and Means Committee, and we are in hearing right now. So we're literally running into different places, kind of tag teaming on what's happening today. But I'm honored to be a co-chair with her on the Integrative Health and Wellness Caucus. This bipartisan caucus has an opportunity to be at the forefront of a national conversation about pain management and comprehensive care. We have the potential to make an incredible difference in the fight against opioid abuse and addiction. Last year, Congress passed the Support for Patients and Communities Act to address our nation's opioid epidemic through prevention, treatment, and recovery efforts. Part of this comprehensive legislation is a look at the need for new methods to treat chronic pain. I've heard from countless doctors and providers in my district who are eager to see the non-opioid methods of treating pain become more integral in patient conversations. I really do look forward to working with all of you and Representative Chu as well. And I just wanted to add this, that, this issue came front and center in our lives in South Bend when Dr. Todd Graham, who was an incredible doctor, one of the most empathetic guys I've ever seen in my life, that really put into motion the kinds of things that he talked about and the kinds of things that he believed when it came to really looking for new creative ways of research and innovation to be able to address pain. And, it was just a little over a year ago when he was shot and killed in the driveway of his own practice by somebody who tried to falsify a way to get opioids. And that person went home and got a gun, came back, and when Todd went to get out of his car, he shot him. Made national news. And, you hate to see something like that happen. It was horrific. He was a very, very good friend of mine and just an upstanding leader in this issue with pain management. And it was that issue that changed this nation's mind, because that issue rang home to every single community in this country as to what are we willing to take as a toll here until we get serious about this integrative medicine, and that there are ways around this and we're going to have to fight to do it. So I've been a leader in this fight, and I so much appreciate all of you in the room. You're the experts. We're the ones that just are the ones that are servicing constituents as they come with needs. But I can tell you that I am more than anxious to work with you and find a solution that this country can adopt and get out of the business we're in, which is this massive amount of death and destruction coming from the overuse of opioids. So thank you so much for what you do. You're on the front line. You're making it happen. So thank you.